Hi, my name is Matthew Stelly, and this is a public service announcement for STIs and infertility. Infertility is a condition of the reproduction system that prevents conception. It affects approximately 6.1 million individuals throughout the United States. The diagnosis of infertility is usually given to couples who have been attempting to get pregnant for at least 1 year without success. The preventable cause of infertility is an untreated sexually transmitted infection. The two main STIs responsible for infertility are chlamydia and gonorrhea. They are both bacterial infections. These STIs can affect the fertility of both men and women. Chlamydia symptoms. Most women show no symptoms. Some may have slight vaginal discharge, pain on urination, pain during sex, and experience frequent urination. Most men do show symptoms: discharge or itchy feeling in the penis, mild pain on urination, and infection of anus or throat. Gonorrhea symptoms. Again, most women show no symptoms. Some have slight vaginal discharge and pain on urination. Men usually notice thick, yellow-green discharge from the penis, pain on urinating, pain in penis. In women, if left untreated, gonorrhea and chlamydia can infect fallopian tubes and the uterus and ovaries. This is known as pelvic inflammatory disease, or PID. PID is painful, but sometimes has no symptoms and goes unnoticed. This is known as silent PID. Gonorrhea and chlamydia can scar women's fallopian tubes, blocking eggs from traveling down the tubes to meet sperm. In men, when STIs are left untreated, testicle infection can develop. Testicle infection is a scarring and blockage in the sperm duct and urethra from untreated gonorrhea and chlamydia, causing male infertility. Both chlamydia and gonorrhea are bacterial infections. They are curable and can be treated with prescription antibiotics. The key is to get treatment early. The antibiotics will stop the infection, but any damage already done by the disease cannot be repaired with medication. Because men typically exhibit symptoms earlier than women, they usually get treatment early and prevent further damage to the reproductive tract. STI screening and prompt treatment, if infected, are critical to protect a person's health and prevent transmission to others. Abstaining from sex, reducing the number of sexual partners, and consistently and correctly using condoms are all effective STI prevention strategies. Women who reported regular use of condoms in one study were 60% less likely to become infertile. The only certain way not to get an STI is not to have sex. Nationally, approximately 65 million people in the United States have an STD. Recent studies conducted by the World Health Organization show that 38% of infertility cases are caused by STIs. Consequently, 15% of all infertile American women are infertile because of tubal damage caused by untreated STD. 12% of all infertile American men are infertile because of inflammation of the testicles and sterility caused by untreated STDs. Louisiana currently experiences some of the highest rates of sexually transmitted infections in the United States. According to the CDC's 2012 STD surveillance report, Louisiana had the second highest rate for gonorrhea and fourth highest rate for chlamydia. Consequently, this makes Louisiana a leader in STI-related infertility also. Within Louisiana, as reported by the CDC in 2012, the Lafayette region has one of the lower rates of both chlamydia and gonorrhea infection. If you are sexually active, be sure to talk to your healthcare provider about STI testing. Women should ask their doctor about annual chlamydia and gonorrhea screenings. There are STI tests available for men also. In the case of STIs, infertility is preventable. Treatment is needed upon signs and symptoms of STIs and PID. Treating these infections helps preserve fertility.